Live from KTVN Reno, you're watching 2 News at 5.
Hi everybody, I'm Landon Miller. Kristen is off this afternoon, and thank you for keeping it here at 5 o'clock. If AB 358 passes, the state would repay tuition for graduates of the UNR and UNLV medical schools. The reimbursement would be in exchange, though, for working in rural Nevada for 5 years. Paul Nelson joins us now live in the newsroom. And Paul, why do people think that this bill is so important?
Well, recruiting doctors to small towns has its challenges, Landon. In fact, Nevada ranks 4th from the bottom in the U.S. for doctors per capita. The bill sponsor says this would help keep Nevada's young doctors in the state, especially in the rurals. Pershing General Hospital is where many Lovelock residents get their health care.
How are we doing with all your meds?
Officials say the hospital is doing well financially, but hiring new doctors can be difficult.
See, your blood pressure today is looking great.
And some physicians don't stay for long.
That provides, limited care for people who like to see the same provider over and over. And we are actually getting patients from Winnemucca now who have lost their providers.
Photoreceptive light cells.
UNR medical students like Joseph Lewis could be the answer. The problem is it's expensive getting through med school.
You get your MD and that's awesome, but you end up owing a lot of money at the end that isn't repaid for, honestly, decades.
Sit forward for me.
If AB 358 passes, doctors who graduate from UNR and UNLV would have the option to work in rural hospitals for 5 years. Then the state would pay off the tuition portion of their student loans.
It's a way for them to get a portion of their loans forgiven, paid back, and get exposed to the rural communities that they may or may not be familiar with, and they may fall in love with it and want to stay.
The UNR School of Medicine already has a rural outreach program. Students can also do 1-month residencies in some of those areas.
I believe that those are areas that, going out there and living in are worthwhile and something I could see myself doing in the future.
The Association of American Medical Colleges says nearly 80% of students who do rural residency in Nevada are likely to stay here.
If we're able to combine those two and make it something that will keep physicians in Nevada after we graduate, I think that's a very worthwhile thing to add.
Lewis has already worked in places like Dayton and Silver City. That's part of the School of Medicine's Rural Outreach Program. He says this could also encourage small-town kids to pursue a career in medicine and move back to their hometowns to work. Covering the 2019 legislature live in the newsroom, Paul Nelson, 2 News.